Hello, everyone. My name is Graciela Guerrero, and today I'll be talking about opioids. So, what are opioids? Opioids are a class of drug that's naturally found in the opium poppy plant. Some prescription opioids are made from the plant directly, and others are made by scientists in labs using the same chemical structure. Opioids are generally prescribed by physicians to treat physical pain, and some examples are oxycodone, hydrocodone, fentanyl, and morphine. Now, how do opioids work? Opioids attach to proteins called opioid receptors on nerve cells in the brain, spinal cord, gut, and other parts of the body. When this happens, the opioids block pain messages sent from the body through the spinal cord and to the brain. So, how are opioids taken? They can be taken by pills, lollipops, injections, IVs, or skin patches. Let's discuss the effects on the brain. So opioids trick the brain into thinking that it does not need to produce dopamine on its own, and this causes people to crave more opioids. And after using opioids for a long time, they can lead to an increase of sensitivity to pain. Opioids can disrupt the brain's impulse control regulation. Now let's discuss the effects on the body. It can cause drowsiness, confusion, nausea, constipation, euphoria, and slowed breathing. So in regards to the risk of opioids, it can lead to physical dependence, which occurs when you use the drugs for more than 2 to 4 weeks. It can also lead to psychological dependence, which can occur if an individual continues to use these drugs, and after using opioids for a long time, an individual develops tolerance and starts to crave higher doses. It can also lead to addiction. Opioids can lead to addiction since they release endorphins, and once it wears off, it makes you want more. Anyone who takes opioids is at risk for developing addiction. Let's discuss the withdrawal symptoms. It can be difficult for people to quit using drugs because of the harsh withdrawal symptoms that they may experience, such as sleep problems, severe cravings, muscle and bone pain, and diarrhea and vomiting. So who uses opioids the most? It tends to be the young population between ages 18 to 25, and college students are within this range. So it is important to educate them and take preventative measures. In regards to the opioid epidemic, in 2017, HHS declared a public health emergency on the opioid crisis. In 2019, over 70,000 people died from drug overdose. Some opioid treatments can include medications and behavioral therapies, such as cognitive behavioral therapy and multidimensional family therapy. Some warning signs of opioid use are avoiding family and friends, mood changes, depression and anxiety, and sleeping for long durations. Thank you for listening.